Artery embolization is a fancy word for us blocking down an artery with a couple of different things. So depending on what we're trying to accomplish, we could be blocking it down with something that's called coil, which is a little metal fiber that we put inside an artery to block it off. We could be using something that is to block off more distal arteries, such as particles. When we block off arteries for, let's say, a prostate or a uterus, we generally use particles. And then we can also do embolization with something that's temporary, such as foam, if we want to block off something just for a short period of time and then allow blood flow to resume down the road. Prostate artery embolization is a new treatment for enlarged prostates, also known as benign prostatic hyperplasia, or more commonly BPH. There are many men over the age of 50 that are diagnosed with BPH as the cause for their urinary issues. They'll complain of things like going too often, not being able to completely empty their bladder, having a weak stream, or having to make multiple trips back and forth to the bathroom just to completely empty their bladder. When they are discussing options with their provider, many of them don't like the side effects or don't like the approach, which is generally through the urethra. So we're able to offer an alternative approach, which is somewhat of a less invasive approach than traditional surgeries. So prostate artery embolization is a catheter-based transarterial procedure. So it's a different type of catheter than the catheter that goes through the urethra. It's kind of like a small IV. We'll place this in your artery that feeds the prostate gland on the right side and then on the left side, and we'll drip these small, soft plastic particles, and that's the process that's called embolization. Particles will slow down the blood flow in the prostate. It won't completely block off all the blood flow, and this will cause the prostate gland to shrink slowly in a controlled fashion over a couple of weeks. And after those few weeks are over, guys will start to notice that they're able to urinate more freely, they're able to more completely evacuate their bladder, and a lot of those symptoms that were due to the enlarged prostate will begin to regress over 2 weeks, 4 weeks, 6 weeks, and out to 3 months. And then at 3 months, patients will be their new selves for 5, 6, or 7 years afterwards.